Intellectual disability. Intellectual disability is a significant neurodevelopmental condition that fundamentally affects how an individual processes information, learns, and navigates daily life. Under the Rights of Persons with Disabilities Act 2016, intellectual disability is defined as a condition characterized by significant limitations both in intellectual functioning, such as reasoning, learning, and problem solving, and in adaptive behavior, which covers a range of everyday social and practical skills. How to determine intellectual disability? 3 core criteria must occur simultaneously for determining intellectual disability. First, there must be a significant limitation in intellectual functioning which corresponds to an IQ score below 70 on standardized assessment scales. Second, there must be significant deficits in adaptive functioning impacting at least 2 daily domain areas across conceptual, social, or practical life skills. Third, these limitations must have their onset during the developmental period, specifically before the individual reaches 18 years of age. If similar cognitive impairments occur after age 18, such as through a stroke or traumatic brain injury, they are classified as acquired neurological conditions rather than an intellectual disability, because an intellectual disability reflects a condition of developmental growth rather than a loss of previously established adult intelligence. How intellectual functioning is measured. Clinically and educationally, intellectual functioning is assessed using standardized intelligence tests, or the so-called IQ tests, such as Malin's Intelligence Scale for children or the Binet-Comet Test of Intelligence, administered by trained professionals such as psychologists. The general population average IQ score is 100. An IQ score below 70, typically 2 standard deviations below the mean, indicates a significant limitation in intellectual functioning. Simultaneously, adaptive behavior is evaluated using clinical rating scales and observational interviews, most notably the Vineland Adaptive Behavior Scales or the Behavioral Assessment Scales for adult Indians with mental retardation. Based on standardized IQ testing, individuals are classified into 4 distinct levels of severity. Mild intellectual disability is in the range of IQ 50 to 69. Individuals with mild intellectual disability are often referred to as educable. They typically acquire practical language, basic functional academics up to roughly a primary school level, and independent self-care skills, allowing them to live and work independently with minimal societal guidance. Moderate intellectual disability. This is in the range of IQ 35 to 49. Individuals in this range are considered trainable. They experience noticeable speech and motor delays, can master basic functional communication and simple self-care routines, but require ongoing supervision for academic tasks, complex safety, and structured employment. Severe intellectual disability. This covers a range of IQ 20 to 34. Individuals in this range show limited expressive communication, marked motor impairment, and significant cognitive delays. They require long-term support for basic daily living activities and personal hygiene. Profound intellectual disability. This disability covers a range of IQ below 20. Individuals at this level experience severe restricted mobility, nonverbal or rudimentary communication, and extensive medical comorbidities requiring pervasive 24-hour nursing and personal care. How to identify the children with intellectual disability in the classroom. To identify and support students in the classroom, special educators look for distinct behavioral and cognitive characteristics, each highlighting a specific area of learning need. 1. Abstract reasoning difficulties. These result challenges in grasping non-physical concepts, symbolism, or metaphorical language requiring concrete, tangible learning objects. Limited memory capacity manifests in reduced working memory and short-term retention, causing students to forget multi-step instructions unless broken down and reinforced. Delayed language acquisition causes slow vocabulary growth, speech articulation challenges, and difficulty constructing complex sentences or understanding figurative speech. Slow processing speed results in taking significantly more time to absorb information, connect ideas, and formulate verbal or physical responses. Difficulty in skill generalization manifests in struggles to take a skill learned inside the classroom, such as counting plastic coins, and apply it in a real-world setting like a grocery shop. Immature social interaction involves reduced awareness of subtle social cues, heightened susceptibility to peer influence or gullibility, and difficulty maintaining age-appropriate peer relationships. Deficits in self-direction and safety results in the challenges in anticipating danger, managing personal time, following routines independently, or making complex choices without guidance. To address these characteristics and ensure effective inclusion, teachers must implement specific evidence-based pedagogical strategies, such as task analysis. This involves breaking down complex, multi-step learning tasks into small, sequential, bite-sized microsteps, teaching one step at a time until mastery is achieved. 2. Use of concrete manipulatives and visuals. Teachers should anchor abstract mathematical, scientific, or language concepts using physical objects, picture cards, real-life props, and tactile materials rather than relying purely on verbal lectures. Repetition and overlearning. To provide frequent, structured practice opportunities across varied classroom and real-world settings to ensure long-term skill retention and successful generalization. Visual schedules and structured routines. To use clear pictures, teachers should use clear picture schedules, color-coded boards, and predictable daily routines to reduce anxiety, improve time awareness, and promote self-directed transitions between activities. Prompts and fading. Teachers should apply systematic physical, visual, or verbal prompts to guide the student toward correct responses, gradually fading the support as the student gains confidence and independence. 6. Functional academics and life skill focus. Teachers should prioritize practical, usable academic skills such as recognizing safety signs, telling time, managing small money amounts, and practicing basic hygiene over abstract theoretical content. 7. Individualized Education Program, or IEP in short. Teachers should design custom-tailored learning goals with measurable benchmarks, incorporating positive behavioral interventions and strengths-based reinforcement